Okay. So the marking point is just feel the patella. I usually just use the patella. You push it down, you just feel there's a bit of medium. Medium. And then the patella is pointed out also. So sometimes you want to bring the knee in a bit. One more. Otherwise you go like that, you tend to okay. So you can go straight, and there's this soft spot. So patella is there. It took quite a while. And usually at the top. So this video, so I will just above here. So what I do is you put a marker pen, so I just put my nail. I just put my nail, and the nail can last long enough to see the mark. And then I don't use local because local you will put one time. Then sometimes you don't put fully anesthetize the whole lot. So we use Royce chocolate. So we put it on. Just apply it for a few minutes. Oh, but M9 is okay. Just, but it's only on the surface. This one, the numbing goes all the way to the side. For 4 degrees. So I normally, at this point of time, I go and see my patient. And the main thing is sterile. So I don't really use gloves. Some of you may find it's not necessary to be quite experienced. As long as you have no touch technique, technically you don't touch it. But we still use polymer. I think that's what the minimum you should use. Alcohol sometimes don't last very long. You evaporate by the time you come in, you know, the technique, the sterility is more there, or you cannot ensure now the size of the needle, you can use, I sometimes use even pink needle, 18 gauge needle, because we used to use synthetic. It's very hard. So very viscous. Oh, sorry. Yeah. So we use a large needle, but large needle means more pain. So generally when the patient see, they get scared. So I always hide it. Prepare without letting the patient see it. So I will prepare here and then I will finish and then I go down. We have this dressing set which I will open. I think sometimes it may not be so economical for you to use a sedative. Actually, this is only about, if I'm not mistaken, 80 cents. So I think to have peace of mind, I think 80 cents is good. But because we are specialists, if we don't use this, anything happen, we got nothing to stand on. I'll show you what I actually do with the nose. Okay, squirt. I usually squirt to don't touch. No touch. So we just squirt when we want a little bit of feel. Glove, and usually by the time this and that, will be 5 minutes. Those who have had injections before, they know the routine. We just bite their teeth for a short while. These are more expensive than the packet. Okay, so now we prepare the where's my needle? Give me a black needle. Black. So if there is fluid, you stand by a 5 or 10 cc syringe because you need to drain spread. You can't suck it into the vial, so because you will go back inside. Okay, you open up one. No, just this one because she doesn't have any sweat. Okay, so it's very simple. You put it, just turn off. Put on the middle. I tend to push a little bit to get the fluid just at the tip. As it fill up so there's no air. Okay, you see a little black place, Okay, come. We can take this off. Okay, we'll take off. I usually use just 2 swabs. There are a couple of pieces of paper we need for you to clean. This one I use because it's a bit of plastic. I just fold it like this, and this, and I tie a small hook. You don't have to buy one special one. Then you see where your mark was, and then you just put it on. Yeah. So to confirm again, there's a patella, so I will move it to center it. The mark is still there, and then you can then feel the soft spots. I use a black and green one. Then you just put the one. And I press the medial side to get it to be tense. If you can stretch the skin, it's even less painful. I'm not using any rope. If you find a little bit of resistance, just pull it out a little bit and you feel it. Khong ah? Khong ah? Okay. You can go a bit slow, and then after that you just finish. One lah. How lah? So that way, infection risk very low. The patient is usually very comfortable. So is the marking. Once you're comfortable with the marking, the horizontal toe slightly in. Just now she was out, so you could hit the kneecap. So as long as you can feel, you can move the kneecap. So sometimes you feel something blocking you, it's probably the kneecap. You just go move a little bit, withdraw a little bit. Hand wipe. Oh, give me alcohol wipe. Hand wipe, yeah. We use this also. That's because the iodine is a little bit sticky. Some people apply a bandage after that. Sometimes they bring their own knee guard, so you can use their own knee guard. And after that, just putting your finger there, press it.
It's easier to approach from the lateral side.
Okay, Dr. Chong will show you the inner side. Yeah. Because he does the arthroscope, we do it through here. But what I don't like is, because sometimes they're very puffy. This is very common. These are fat pad. So fat pad means you have to get through the fat pad. Whereas over here, usually the hollow is very empty. The synovium doesn't collect around this part. So the other way to do it, then you can here or here. Because of the fat pad, if you inject into the synovium, it will be painful. So if you inject and the patient, ouch, that means you are not in the joint. If it's in the joint space, absolutely.